Um, uh,
Hi.
Hi, how are you? Sorry, I was kind of just saw your face there, so a very warm
Nice
welcome,
to see
Donna.
you. Nice to
Yeah,
see you.
you too, you too. So it's great to see everyone here. I think we've got 62 people here. The session's just started recording. I can see more people are coming into the session. So let's just give people a moment to do that, and then we'll do the welcomes and the intros and all that kind of good stuff and get to know each other. So I'm just while we're doing that, I'm based in a lovely little town called Saffron Walden, just outside Cambridge. So whereabouts are you today? Where are you dialing into? So please do put in the chat function. Let's see all of the areas of the country that are being covered today. So where are you? And if you wanted to put down what the weather's like, I've got blue skies and sunshine, and I've literally not been out all day, but what's it like out of the window where you are today? So where are you, and how's the weather looking where you are at the moment? So just while we're welcoming a few additional colleagues to join us, please do go into the chat function and we'll see whereabouts in the country. Yes, sunny Surrey, Newcastle is fantastic. Lovely Cornwall, Ruth there, lovely Donna in Croydon, Manchester, northeast, Merthyr Tydfil, fantastic Helen. So, gosh, Northern Ireland, Danielle, so we're all over. We are literally all over the country. We've got cloudy, but bright Tracy. Hopefully the sun will work its way through. So everyone's, gosh, we have got lots of lovely blue skies today. Maybe we should have this outside, but it's still a bit cold, but great stuff. Well, welcome one and all to the workshop. So my name's David Little. I'm the CEO of the TCM group, and we'll be presenting in a short while around transformational culture. And there are three of us running today's workshop. So I'll hand over to Nikki Ingham, who I'm sure many of you will know and requires very little introduction, but I'll let Nikki say hello and introduce herself, and we'll be doing a bit more of a talk through in a moment. And Nikki, over to you.
Good afternoon, everyone. Now I've worked out what time of day it is. It's lovely to see you all and some familiar names. People will know I'm the Exec Director for the Healthcare People Management Association's HPMA, of which this event is jointly run with our colleagues at TCM. I also do practice my own consultancy after 15 years as an Exec Director of Workforce in the NHS. And I do work on this topic of justness, of restorative approaches to certain aspects of life in the workforce. But I also do a lot of work around shadow board as well, so aspirant directors, those types of things, as well as anything else that Dean, our president, throws my way, or Joe indeed throws my way. So it's really exciting to be here this afternoon, and I hope that you're all eager to switch off from the day that is around vaccinations, COVID, sickness, absence. It's horrendous. It's just, I don't know how you're all coping, to be honest, because it's just relentless. So this is a nice steer into how we should be approaching things. So a bit of a reminder. So it's really nice to be here, and I look forward to engaging with you later. So thank you, and thanks, David.
Look, I think the thing that kind of keeps us all going is the strong leadership from our political centre, isn't it? That's what kind of keeps us keeps us focused and allows us to sort of keep looking ahead. So that's the thing, I think, Nikki. That's the unifying bond is our political leadership and the strength that we're seeing at the moment, or not, maybe we'll see. Sorry to take it into a political dimension, but obviously we're all watching BBC News with interest as the Garden Party saga unfolds. And Blair Maxwell, very warm welcome to you. I've been working with Blair now for a number of months, helping to deploy transformational culture in a programme called Transformational Trailblazers. Blair, over to you.
Hi, afternoon, everyone. I'm Blair, and to David's earlier question, I'm here in Scotland just now where we have no such political challenges. Everything's rosy up here, believe that if you will. So I'm the strategic lead, as David said, for transformational culture here at TCM. Really great to be here with you all, and thanks so much for coming along with us today. I suppose a quick potted history by way of introduction. I suppose I've entered culture change not through the normal channels. I didn't start as an HR professional to trade, and I know that's normally the traditional route. My training specifically is in strategy, organisational systems and leadership, and I started my career years ago as a school teacher, always kind of with the desire to help unlock people in their creative and intellectual potential. something which I really believe strongly in now as well. And when I moved into a career in learning in OD, I kind of quickly realised that people can't do it alone. To quote Dave Ulrich, people are champions, but organisational systems win championships. And I suppose it's not talent or people alone that make organisations successful, it's the systems that they work in. And culture, obviously, is the fundamental driver of those systems. It's always really fascinated me. I spent many years of my career working at Virgin, how people gave so much discretionary effort based on the culture that the organisation built, and ultimately how that helped the organisation achieve its strategic ambitions. And I suppose that led me to continue in studying culture in depth, in particular the kind of strategic nature and salience of culture. So culture is really at the front and centre of all my work. I've really been delighted to work alongside the NHS and some consulting engagements alongside the BBC and other large institutions. So really delighted to be here with you and really excited for this conversation to commence.
Fantastic. It's great to have you here as well, and looking forward to finding out more about the Trailblazers initiative further down the line. So the way that the session will run today is I'm going to provide some oversight firstly of the research initiative and the collaboration that we've built with HPMA, the Institute of Organisational Dynamics, and ourselves at the TCM Group, and also working closely with Michael West, who passes on apologies for not being able to be here today, but he's also very keen to be a strategic player in this piece of research as well. So I'll set out the research. I'm then going to talk through the transformational culture framework, the model, the system, the process, the principles, how it works. And I'm going to hand over to Nikki and talking about her own experiences, insights and wisdom that she's able to share of just restorative cultures within the NHS and the important role that they play. We'll then hand over to Blair, and Blair will be taking us through a bit more of a granular detail of how it works, the Trailblazers initiative, the research program that we're embarking upon, and also the project management methodology that will be underpinning the process. That will take us, we think and we estimate, around about an hour and 20 minutes. We will have a comfort break at that point for those people who require it. And in the final part of the session, we'll be into breakout rooms. And we're going to ask you a couple of questions in those breakout rooms, just to try and consolidate some of the thinking and give you a chance to, and some headroom to think about some of the content that you've heard. And then we'll come back into the final plenary and debrief and discuss things. We love the chat function in Zoom. Ideas, thoughts, feedback, any questions that you might have, please feel free to pop it into the chat function as we're going along. Conversations with each other. We're not there in person, obviously. We're doing this all virtually. But if we were in a classroom, we might be chatting to someone next to us or asking questions or sharing resources, or please do that in the chat function if there's a particular resource, a book, a paper or a document, or just something you'd like to share. Let's try and make this as close to the real thing as we're able to do so. So we can kind of create that really collaborative space for us all to learn from each other. I'm going to share my screen, and I'm going to start off really by talking about the research objective that we've been working to as part of this programme, and how we'll go into the methodology, and then I'll start to describe what a transformational culture is, because you may not be familiar with that term. Some of you may be more so. So the research objective, what we're trying to do here is to look at the need for a new cultural paradigm within health and social care sector, and to evaluate the impact of a transformational culture on health and social care organisations. Again, I'll describe what transformational culture means shortly, but it could, in a basic sense, it's a culture which is described as being fair, just, inclusive, sustainable, and it really focuses on sustainability and high performance, and recognizing there's a correlation and a relationship between fairness, inclusivity, justice, sustainability and high performance. And it's really important to kind of connecting the dots between those different elements. And in a nutshell, it's people-centered, values-based and purpose-driven is the culture. So the research areas, there are 6 specific areas we'll be focusing on through the research. We'll be looking at the need for a fair, just, inclusive, sustainable culture, the need for transformational culture. And I think when we're talking to trust leaders, there's a desperate search for a new cultural paradigm and a new set of cultural orthodoxies within the NHS to help their people, your people, be the most brilliant versions of themselves. We're going to look at I think of this as a starter, being like almost improving working lives 3.0. So we'll look at the development of cross-functional culture hub within trusts to develop, deploy and sustain transformational culture within the organisation. We'll look at the 8 enablers, which I'll mention shortly, so you can see what are the 8 enablers of a transformational culture and what impact do they play. What are the outputs, the outcomes and the impact of a transformational culture, the 7 C's, not the 7 C's of Rise, the Queen's song, but the 7 C's of transformation. And then we'll also look, and it's really, I think, important, at the interconnection between the internal employee experience, the cultural norms and the dynamics within the organisation and the impact on patient outcomes. And Chris Turner, who I know very well, and I'm sure many of you will also, in terms of civility saves lives, is making some really powerful connections between the internal environment and the impact and the outcomes for patients. And I'm really keen that we explore that through this research initiative. And we'll also be looking at the work that Michael West and NHSE and I have been doing, developing what I think is a really powerful research, project management methodology, the Culture and Leadership Programme. So we're in conversations with NHSE and I in relation to that, and we'll also be looking at the interrelationship between this and CLP as part of this research. And finally, before I go into what it is, the research methodology, we'll be developing a cohort of 6 to 8 health and social care organisations who will become transformational trailblazers. So that's sort of case study-led research. We'll be doing surveys, all the classic stuff really, surveys, structured interviews, case study analysis, and then quantitative data. And we're hoping to be able to report back, a substantive report back in late spring, early summer. The chances are, come late spring, early summer, most trusts who are beginning on their culture transformation process have only just begun. So there is a question of what are we able to present back at such a short time frame. However, that will be the starting point and a phasing. We will be doing a longitudinal study of the impact of this, but just to get something out there in terms of what's happening and the potential impact, we are looking to present back an initial interim report fairly early, just to talk about some of those early wins and the early gains of those organisations who've begun this journey. Nikki, Blair, is there anything that you feel is important to add at this stage, just in terms of the research methodology and the partnership that we're fostering between ourselves at the moment?
I think just to echo, it's a really exciting opportunity for everyone in terms of the learning that will come from this, and never has the time been so rife for reviewing and researching this topic. So echo everything you've said, David. Thank you.
Yeah, no, nothing in addition from me. Just I think Nikki really hit the nail on the head. Now seems the perfect time after the turmoil of the last 2 years to really start thinking about this work and developing our learnings from the last 2 years as well. Absolutely. Well,
thank you very much. And so just to reiterate, if you've got any questions for Nikki, for Blair and myself, please do put them in the chat function. Tracy, I can see someone's been very naughty and double booked you. So we'll use our just and restorative approaches there. But it is being recorded, Tracy, so don't worry, we'll get the recording over to you, and hopefully you'll be able to listen to that at your leisure as a podcast. But please do feel free to put comments, thoughts and questions in the chat function. But Nikki and Blair, thank you for that support and endorsement there. So I'm going to at the first part of the session, which is to try and unpack and describe the session. No problem, Carol. We'll make sure you get the recording as well. So that's on its way to you after the session. So I'm going to how to integrate a transformational culture within your organisation. So a very warm welcome to you, and what we'll be doing is focusing on the themes and issues in my book, Transformational Culture, Develop a People-Centered Organisation for Improved Performance. And in my book, as I mentioned, it provides a blueprint and a framework for trusts and other organisations who are looking to integrate a transformational culture. That's my lovely town, Saffron Walden, as I said, and obviously we've got people from all over the UK. So my background, for those of you who don't know me, my background is in race and community relations. So I grew up in Nottingham in the sort of 70s and 80s and saw racism, and I guess many of us did at the time. And I wanted to understand racism, and I wanted to understand how we could tackle racism. So I signed up for a degree in race and community relations to help me understand the nature of exclusion and what we can do to promote inclusion. After my degree, I was president of the union for a bit, and then I went to work in Leicester in the area of economic and social regeneration, particularly working with Black minority ethnic communities in Leicester and around Leicestershire. And I saw firsthand really just how woefully poor our societies were at tackling conflict and discrimination, and sending in police cars at 2 o'clock in the morning and a more punitive and adversarial approach was not delivering good outcomes within communities. So I set up one of the first mediation and restorative justice programs in the UK, in Leicester. And that was your degree as well. So were you at Edge Hill? I don't know who that is, Jay Toki. Were you at Edge Hill? Edge Hill, whoever Jay Toki is, were you at Jay Toki? Were you at Edge Hill University? It'd be great to know if you were. I might have another fellow Edge Hiller there. So I set up and ran one of the first mediation and conflict resolution programs in the UK as charity, and I got actively involved in restorative justice from low-level disputes right the way through to significant crime, sexual crimes, and also murder and unlawful killings. So I really experienced restorative justice. I was trained by an amazing restorative justice practitioner, Barbara Tudor, who was a leading light, and as it is a leading light on restorative justice. Anyway, so I move on. So I did an MBA. I set up the TCM group. The TCM group comprises a number of companies within the TCM group providing mediation and other services. I'm in the top 20 HR most influential list, top 20 most influential thinkers, and won other accolades and awards. And last year we won a fantastic award with Personnel Today, driving a cultural change and resolution framework within TSB Bank. And we've had such a lot of fun working with TSB, helping to drive those changes. So I've got 3 kids, a snake, you might be able to see the snake just behind me, and geckos and chickens and a dog, Barney, who no doubt is going to make an appearance at some time during the session. And those are my 2 books, Managing Conflict, which was really saying to trust leaders, HR and others, let's rip out the grievance procedure, because that grievance procedure is so deadly and corrosive and adversarial. Let's rip it out and replace it with something people-centered, purpose-led, values-based, called a resolution framework. And everyone was saying to me, that is fantastic, but what about discipline and performance? So my new book looks at removing the corrosive and adversarial performance, disciplinary and grievance procedures, and then integrating those systematically into the organisational culture. And that's in essence the theme of my presentation today. So why transformational culture? Why does it matter? Well, a transformational culture is fair, just, inclusive, sustainable, and high performance. And it offers a time of desperate need where everyone's striving to build back better. We're wanting to come out of COVID, desperately, obviously wanting to come out of COVID. But we've seen some real challenges through COVID. We've seen a real rise of social justice, giving rise to employee activism within the workplace. There are massive workforce pressures in the NHS, driven by so many different factors, but unresolved conflict, bullying and tension within the NHS, as with elsewhere, is a significant impact on workforce and adding to significant pressures there. So we're searching for something. So I tried to create a blueprint and a structure to help guide and steer organisations towards a new cultural orthodoxy and a new paradigm. It's not prescriptive and it's not didactic or directive, but what it is saying is this is what good culture looks like from my perspective. And this is what it looks like. And what it looks like is it's driven by transformational leadership, transformational leaders who are visionary, who role model the right behaviours, who recognise it's not one rule for them and another rule for us. They're leading and supporting by role modelling those right behaviours. They are trusted, respected, and they're driving the changes within the organisation, and they focus on building that trust within the organisation. Supported by a people function, which is values-led, strategic and empowering. And I'll be talking a lot about the HR function and the importance of the people function, decoupling itself as a function of management and becoming an independent people and culture function within the trust in order to be able to drive and facilitate the changes that are required to create a transformational culture. And transformative justice, transformational justice, is a marriage or a blend of restorative justice and procedural justice. We can't rely on due process to get us out of the challenges that we're facing, but we can't rely purely on restorative justice to solve issues either. So just and restorative are great and procedural justice are great, but neither of them are effective in and themselves. So what I've done is I've blended due process and procedural justice So it will prevent and mitigate the risk of an adverse tribunal outcome. It's robust. It works within a disciplinary, a performance, a capability, an absence, and a grievance environment. It's restorative in nature, but still can be applied to deliver procedural justice, including an up to dismissal where it's required. So we'll talk more about that, and it's a really important feature in the cultural model is in relation to justice. And we'll talk about who owns justice in the organisation, and we'll talk about the development of an administration of justice department within the people function. In fact, the people function becomes an administration of justice department and a new model of justice, an exciting, exhilarating model of justice that brings people together and creates cohesion, creates powerful relationships that helps people to be their most brilliant versions of themselves and deliver the most effective patient care to people who are in need. And Dave Ulrich and I have got to know each other well, obviously the founder of the Ulrich model, and he and I are working on an article behind the scenes, which we'll be publishing later in a couple of months' time. And he wrote the foreword for the text, and it's really banging the drum for a shift towards a transformational culture model. I'm really grateful to Dave Ulrich for his support and his continued support now for this new cultural paradigm and this new approach. So I'm interested to know, I mean, when I was doing the research for my book, I kind of put in what is culture into Google, and I came up with about 4 million different definitions. It was quite something, it was quite staggering. And, you know, I sort of think there's probably 4,000,001 now that I've added my own in, and probably it's growing exponentially. So there is clearly no right or wrong answer of what is culture. So just in the chat function, what does the term culture mean to you? When you hear the word, you think of the phrase, you know, we're all talking about it. What does it mean to you? I suppose you could, a supplementary there is what differentiates a good culture, whatever that might mean, from a bad culture. And there are lots of words with bad culture: toxic culture, bullying culture, and destructive culture, so on and so forth. So what does it mean to you, and what differentiates a good culture from a bad culture? And so take a little look at what's going on. I love this when the chat function starts to come to life and you see all of the ideas being shared and the thoughts being expressed there and the insights. So how things are done around here. So those norms and those basically the norms of behavior and how things are done around here, the way things are done, how you work and how others respond, norms, values, ways of working, values and behaviors. So really powerful. There's a relationship between the values, the behaviors, the way that things are done. Believing as one, there's a unity then that brings us together. Tracy, I think it's really interesting that you've mentioned that, the way that bringing people together, common, and I think of that as common purpose and a shared common purpose behind the purpose, the way we do things, how we are, what we do. So there's a lot of focus on shared experience and a shared understanding around a shared set of behaviors, competencies and values. And so to an extent, we've already established there through our definitions that the way that we do things around here is really challenging, because what happens departmentally, what happens organizationally can be very different. People have different beliefs, different values, different backgrounds, different training, different experiences. So the way that I do things might be very different to the way that other people do things. So in order to be able to manage culture and to be able to create a positive culture, the first thing that we need to be able to do is to start to have a conversation about what are those norms, what are those values, what are those beliefs, what is the purpose, and how can we create a shared and common purpose. And to me, at the heart of culture is discourse and dialogue. And within a transformational culture, we give dialogue primacy. And when I'm working within trust, it's always been curious to me that we understand and recognize and know the importance of dialogue, yet we've created systems and processes and vehicles which actually diminish or block dialogue. And therefore it becomes very hard to understand what those norms, what those values and what those beliefs are. And so we rely then on often quite punitive and adversarial systems and processes to create those norms, where actually through dialogue, insight and understanding, we can create a new set of norms and therefore create a new cultural framework. So Megan, you've talked about good culture is collaborative and cohesive, bad is fragmented and undermining, and it's really important. Thank you so much, Megan, for sharing that. I really like the way you've described the difference in those two different forms. Ruth, you've talked about the ecosystem and the feelings, and that's really interesting. You've talked about the first F word of the webinar, Ruth, feelings. Something which I think many organisations struggle with, particularly in the NHS. There are other F words: fear, failure, goodness me. fights, and how we manage these F words. But feelings is interesting because often when I'm working with often senior managers or clinical leads and surgeons and working in theatres who are dealing with bodily fluid coming out of people from all the different places that it probably shouldn't be coming out of them. Yet when we start talking about feelings and bodily fluids coming out of their eyes and out of their nose, it strikes fear into the heart of people who are so used to dealing with bodily fluids. And it always strikes me as being interesting how we've really starting to become very fearful of emotions and feelings. Yet within a transformational culture, within a good culture, we have really open conversations where we can talk about feelings and emotions. We're not fearful of those, because if we can understand the feelings, we can start to elicit and understand the needs. And a good culture sets about an understanding of individuals' needs, matching those needs together and aligning those needs to the common purpose and to the values of the organization. So a big interconnectedness. And so the culture cannot be thought of as a single linear process. Culture is a system, and we're talking more about system. So ideas, customs, and social behaviours as part of a society, rather. And again, that links into that whole systems thinking, I think, and seeing this as a system. So I think there's the other thing I think that's coming through the chat function, I don't know if you can see this as well, colleagues, is it's very subjective. It's hard to codify. It's very much about how we feel, how we see, how we behave, what we do. And I think we're not very good at subjectivity. For those of you in ER and HR functions, we don't like subjective. We like 51%. We like balance of probability. We like to pass the Birchall test. We like to be able to stand up to scrutiny in a tribunal or in a disciplinary process. We're very uncomfortable with subjectivity. We're very uncomfortable with aspirations, feelings, goals, perceptions, needs, hopes, and fears. We're very uncomfortable with the grey area. Well, human beings exist in the grey area. And within a great many trusts that we've worked with, that I've worked with, they are very uncomfortable in the grey area. And to an extent, everything that we're saying here about culture is in opposition to the systems and processes that we've defined in our organisations, which are in themselves polarizing and can only function on the balance of probability being achieved of 50+1%. And there's a real stark challenge and conflict within our trusts around good culture and the systems that are deployed to manage the challenges that people bring into the workplace. Something we need to address this if we're going to have a really good quality conversation about culture. So as I said, there are 4 million definitions of culture. I'm not going to put 4 million slides up for you, but the one I like the most and the one that seems to really speaks to me the most is the culture of any organisation is shaped by the worst behaviour that the leader is willing to tolerate. Well, whether or not that's within the leadership team or whether it's somewhere in the organisation of someone who's performing really well and we'll just let them get away with that bullying comment or that negativity or that sarcasm or that unpleasantness to others, that sets the tone. That sets the culture. And I think we all know and can understand and probably relate to the fact that the worst behaviour in the organisation sets the tone and the climate of the culture of the organisation. So I'd like to introduce you now to the transformational culture model. I don't want to say or suggest for one moment that this is a prescriptive model, but it is a blueprint. And I think it's really important when we're going into organisations and talking about, we've already established it's nebulous, it's abstract, it's subjective. It's very hard to talk about culture if it's nebulous, abstract, and subjective without having some kind of a framework of what does good look like. So this is offering up a version of good, and then it's really up to the organisations about their variations and versions of good. So I don't offer this as as I said, a prescriptive definition, but it is a version of a good culture. And it's using systems thinking. So Danella's Meadows and Ash's done a lot of fantastic work in relation to systems thinking, but it's a set of related components that work together to perform a particular function. And I guess culture could be absolutely described as this. So there's the transformational culture model, which I'll be talking about in a little bit more detail. It really starts off with a focus on cross-functional working and a transformational culture hub. Who's responsible for culture? Feel free to pop into your into the chat function. Who owns the culture? Who's responsible for culture? Who does culture in the organization? It's everyone and no one's responsibility. Perry Timms, when he wrote a really excellent piece for my book saying, well, kind of HR have done it, but they've done it almost because they're kind of taken it. So who owns it? Now, I would argue that the culture of the organization is the greatest asset, but also its greatest liability. And we've got everyone in the organization, all of us, it starts with us, it's everyone. I mean, I think I'd say there's a complete consensus in the chat function that it's everyone. So is it in our job descriptions? Is it in our role profiles? Is it in our competency frameworks? Is it in our development pathways? Is it in the coaching methodologies we have with our coaches and mentors? No, 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 and no, I think would be a fairly good answer to that. So it's everyone's responsibility, but actually technically it makes it no one's responsibility. And it makes it very hard. So it's subjective, it's nebulous, it's hard to describe. It's not in our job descriptions. Everyone owns it, but then no one owns it. It's very hard to measure and quantify. And suddenly now we've got this really quite exciting, but really challenging space called organizational culture. So the Transformational Culture Hub owns the organizational culture. And the Transformational Culture Hub is a cross-functional team within the organization, chaired by the Chief People Officer, with stakeholders including your union colleagues, Speak Up Guardians, employee groups, managers, HR, comms, legal, so on, so all coming together. So think Improving Working Lives 3.0. I'm very deliberately and actively advocating for cross-functional working within the organisation. Now, the cross-functional Transformational Culture Hub reports directly into the exec, and it's got a direct line in there in terms of accountability and good governance, good clinical governance within the organisation. It works in a way which is collaborative, predictive, and proactive. And I'll explain more what those terms mean specifically, but collaborative, clearly coming together. Predictive is they're using data and analytics to be able to help to predict the changes. And they will develop subgroups and substrands using data and evidence to drive those changes. And they're using that data and evidence to come together and be proactive in identifying problems and preventing them from occurring. And again, if I look specifically at dispute management or performance management, those systems are reactive and are often driven by a punitive and retributive system. So if we're going to unmute if I did that myself, apologies. So if we are going to move towards a transformative model, which is intrinsically adversarial and non-confrontational, we need to think about how we create a more proactive system within our workplace. And that demands a new social contract between the HR function, the management function, and the union function. A social contract where those three, the triumvirate, the heads of state of our workplaces, are coming together and working collaboratively to spot and resolve issues before they occur, not simply coming together on the back of problems after they have happened. Within the center of the transformational culture are what I describe as the 8 enablers, and I'll go into some of these in more detail. But these are the 8 enablers, which when combined provide a whole systems approach to driving culture change. And of course, in your own organization, there'll be elements of this that you're already doing, some bits which are less or more relevant. So it's really up to each organization where the emphasis plays and where you place the emphasis. But I'll run through them fairly quickly now. The first one is about values and purpose. Taking the values off our lobby walls, off our lanyards, and off our email signatures, and feeding them through as a golden thread through the entire employee life cycle and patient experience. And I'll run through a whole systems approach for integrating values and purpose-led methodologies. Using evidence to inform decision-making, so not being afraid of data modeling, data analytics, and using data to drive those changes, and using evidence to help shape the culture. You know, when I go into organizations and do conflict audits, and I go into a boardroom and say to the exec team, let's talk about conflict in the trust. What impact does it have? They say to me, well, it has an impact on our absence and attendance levels, on our workforce issues, on our reputation. There are legal costs, there are financial elements, there's exposure to tribunals, the papers pick it up. I say, great, there's a lot of issues there in terms of data. Now show me the strategy for managing disputes and managing conflict effectively within the trust. And I'm ashamed to say I've seen better strategies for ordering paper clips within most trusts than I have for dealing with conflict in the workplace effectively. So it's really interesting that we sit on this massive amount of data within our trusts that we can identify within 15 minutes to half an hour on a flip chart, yet that data is not utilised to deploy the right strategic frameworks which can actually help promote and perpetuate the right culture within our organisations. And I would argue vehemently that resolution should sit within the NHS People Plan and should sit with every trust. In fact, I would argue that how we manage disagreements and helping people to disagree well within our trusts is the single test of how effective our trusts are at managing people. And how we manage conflict should be the primary and centerpiece of our people strategy, not an afterthought, or indeed in many cases forgotten about. So focusing on that evidence-based approach, the next one is looking at the people and culture function and working with the HR function to decouple itself from the perception of being an arm of management and using processes which protect management and to an extent are also used to damage relationships, the grievance procedure, the disciplinary procedure, the performance management systems, those processes which are intrinsically adversarial, corrosive and damaging, which people are significantly affected and undermined, and their working lives are undermined, which are deployed without often question or challenge. And as I'll be saying, that the sooner we rip those processes out of our trusts and put people and values and purpose at the centre of those, the sooner we'll be getting closer to deploying a truly just, restorative and learning culture within our organisations. Tracy, you've talked about top down. We cannot implement anything without the best intent if you do not support them. Absolutely. It's top down, it's bottom up and it's sideways in, but it has to be driven by our leaders, which is the next enabler, is looking at our leaders and managers. So the first starting point, and I know a great many trusts have these now, a values and behaviour frameworks. One of the most powerful documents in a modern NHS organisation is a values and behaviours framework. Because as soon as you have a values and behaviours framework, that sets out the aligned behaviours, which are aligned to the values, the misaligned behaviours, which are not aligned to the values. From that, you can then draw out your competency frameworks, you can do your development plans, but also, really importantly, is you can start to use some really cool techniques, nudge theory, positive psychology, appreciative inquiry to change behaviour. And we don't need all of these punitive processes in this extensive employee handbook to change behaviour if we start to codify exactly what we want or what we expect in terms of the behaviours and they're aligned to our core values. Where that happens with our managers and leaders that are aligned to those behaviours, then they're creating the culture and the climate. And there's a relationship between culture and climate, which I think is important to come to in the session. And I'll talk a lot about that in the board and that relationship between the two. The resolution framework is the expression of transformative justice. I'll say a few words on that shortly, so I won't say too much on that. I also work with trusts, and we talk about ED&I, and then we do Wellbeing Week or Anti-Bullying Week, and then do some work on inclusion. And it feels like these massively important pieces of work kind of swim down different lanes in the same direction, but often not connected. So part of the transformational culture model is pulling together wellbeing, engagement, and inclusion as a single strategic function within the organisation, to be able to combine those and look at and see the interconnectivity and the relationship between those two activities, specifically to create a happier, healthier, or more harmonious workplace, which in itself is the driver and an antecedent to higher performance. So we're really advocating for a much closer relationship between those three. Sustainability, social cohesion, social justice are absolutely fundamental. And if we're not considering the impact of our organisations on the planet, then I think the time has really come for us to start doing that. And also recognising that, you know, we say into our workforce, bring your whole selves to work, bring you to work. Well, we're all out there campaigning on topics that are important to us: climate justice, social justice, racism within society, misogyny. There's so much, we can see it. It's there. It's on every day on our newspapers. People are concerned about this, and they're bringing it into our workplaces. And they're concerned about it. And we're saying, bring yourself to work. Well, I'm going to bring myself to work, and I'm campaigning, and I feel strongly about this. And we're starting to bang, and we're challenging the orthodoxies of command and control and autocratic management. And for many managers and leaders are struggling to keep up with the powerful voice through employee activism. So a transformational culture harnesses employee activism and is aware of and aligned to social cohesion, social justice movements. And the eighth enabler is looking at the brand values, the purpose, the focus of the organization, seeing the culture as part of the reputation, the employee, and also the organization's branding, being a great place to work, attracting the top talent within your local communities and sustaining that and retaining that within the organization, and also making sure that that culture doesn't sit on your risk register, that it's a discernible and definable asset within the organization that you can measure and cherish and manage it in a way which is adding value. And finally, the outcomes are the 7 C's. I referenced those earlier, about building courageous environments whereby we can challenge each other and challenge the status quo with courage, in a safe space to be able to challenge, where we connect with each other and we build into connections, where we build collaboration, a sense of shared and common purpose. And again, when I go into surgical teams or wards or clinics, and it's damaging and they're in deep distress, but there always seems to be this thing that glues people together, which is we're here for the patients. But I've been hearing recently in my work that even that's starting to become a little bit eroded within some teams. It's still there, and it's the one thing that holds sometimes very broken teams together, but even that's feeling a little bit flimsy now as a sense of common purpose. We need to be better at shaping and structuring a common purpose that we can all be part of. And as everyone said at the start of this session, it's something that we brings together, something that's a shared experience. Well, what is the shared experience in our NHS organisations at the moment? And how do we codify that? Building on the work of Michael West, focusing on compassionate leadership, a massive fan of that. And I think it's such an important attribute and element to be thinking about throughout the entire system, as being empathetic, understanding, compassionate, driven by good quality conversations, good quality dialogue, which is itself curious, where we're asking people, how are you feeling? What do you need? How are you today? How are you today? We all need to be asked that at the moment. And we're curious, and we have the capacity to respond positively to that. So those outputs, those 7 C's, they turbocharge the culture. So they're not just outputs, they then feed back in and drive those culture and help the organisation to achieve its strategic objectives and to drive those cultural changes. So I'll stop speaking in a moment. Michael West, as I've mentioned a couple of times, he wrote a really fantastic review of my book, Transformational Culture. So I'm very grateful for him. As I said, he's not able to be here today, but he will be a key part of the work that we're doing with the HPMA. So I'll stop there. That's the model. And conscious of sort of talking at you there for a little while. So I'll probably just pause for breath and invite questions or thoughts or reflections on anything that you'd like to share or say or ask in relation to the transformational culture model, the thinking behind it, the theories, the frameworks, the systems that I've been describing there, and any questions that anyone has got in relation to any points that I've raised so far. So over to yourselves, and please feel free to use the chat function, or if you wish to, you can come off mute and ask the question directly if you so wish. So any questions from the model that I've just described? I suppose that's on top of that, just to kind of give you some thinking time. Is there anything that you're doing within the model, within your trusts at the moment, that you think will help to integrate a transformational culture? Is there anything that you're doing at the moment that kind of felt like some of the stuff I was saying? Anything that you feel, yes, we're already doing that, or we're starting to see an impact? I know at least one. Donna, I'm looking at, so I've got you, who the resolution framework within London Ambulance Service. There's no disciplinary and grievance procedure within London Ambulance Service. You've got the resolution framework. Donna, I don't want to kind of put you on the spot, but as I can see you there, I mean, do you want to, is there any value or merit in saying anything on that piece of work? So that was a really exciting piece of work that you've obviously picked up at LAS.
David, I love the way you say, well, I'm not going to put you on the spot and then put me on the spot.
I'm so sorry, Connor. Feel free to tell me to go away if you wish to.
Yes, it's exciting. I came after the resolution framework was launched, so I wasn't in the build up to it arriving, although I was in a different charity outside of the NHS and where we'd had got rid of the grievance policy. So for years been an advocate and championing getting rid of grievance policies, at least. So coming to the London Ambulance, where they have torn up their grievance and disciplinary, has been exciting and challenging. If I'm honest, it's on a journey, David, and anyone listening, but in the right direction, I believe. To have taken the bold step to say that we're an organisation that will do things to really promote a just and learning culture is fantastic. So yeah, we're still in early days, but I can see there's challenges, but it's also incredible.
I am so sorry for putting you on the spot, but I think you handled being on the spot fantastically well there, Donna. So I'm going to say thank you very much for getting me off the hook there a bit. But Donna, I mean, to me, these grievance and disciplinary procedures are insidious. They deliver no value. They are intrinsically racist. The report from NHS England that actually identifies you're more likely to be a subject of a disciplinary procedure if you're a Black employee, and you're more likely to get an adverse outcome from a grievance if you're a Black employee. So not only do the processes not work, less than 10% of disciplinary processes result in any sanction against the alleged wrongdoer. And in some organisations, it's into single figures, unless you're a Black employee, in which case you might double those figures up because you're more likely to have an adverse outcome. So they don't work. They tear the heart out of teams. We run an investigation arm in the TCM group, so we can see this. It tears the heart out of the teams. I think the Amin Abdullah case has been quoted many, many times, but it highlights, and then the Dido Harding review highlights just how destructive and damaging those disciplinary procedures are, and for what purpose. Who benefits? Who benefits from that stuff? The grievance procedure, I've been talking about the grievance procedure for 20 years, and not once ever in all of my working life have I ever spoken to anyone ever who says that the grievance procedure adds value to the organisation. Value defined by happier employees, stronger working relationships, and effective outcomes. Never once. I've never, ever, ever heard an example of a grievance procedure that adds value. Yet they sit there in our employee handbooks as if they have some immediate right to exist. There's no statutory, there's no moral, there's no legal duty on employers to have these things in the workplace. Michael Gibbons came in 2007 and ripped up the old statutory dismissal and grievance procedures, and it was replaced, unfortunately, with just a muddle and a mess. But there is a real opportunity to be innovative, and Donna, the work you're doing and colleagues are doing at LAS, and now we're working at North East London Foundation Trust. They've just begun the route to doing this as well, and many other trusts are now starting to say, let's rid ourselves of these processes and let's trust our people, but give them the support to be able to resolve issues effectively. But I'm a real passionate advocate of resolution, and Nikki, I'm conscious of time, and I could just chat away forever on this stuff, but there are actually 3 of us talking on today's webinar, so I ought to probably be cognizant of that. And Nikki, I'd like to hand over to you at this point. We've got one eye on the chat function, but Nikki, if I could hand over to you, if that's possible, to share your thoughts and your insights and your experiences that are kind of leading to this work that we're doing together.
Yeah, thanks, David. You've talked a lot there about the different approaches and I suppose the business case for why wouldn't you want to adopt this approach. So my reflections come from two perspectives, really. One is as the personal impact of working or engaging with this approach. The second is the work that I do as a facilitator with Merseycare, who many of you will know have adopted a just and learning culture, very similar to what David's outlined there. So just coming from my experience of going through that process, that program, and listening to staff and reflecting. So I think at the moment it's never been, I think I said it in the intro, it's never been the time is now for this in terms of cultural transformation. The 4 nations which HPMA represent have all got or are working on people strategies that have people at the heart. But it's been acknowledged that people management, so people that have hands on people, that have hands on patients, clients, service users, are just an important role to play in establishing and supporting the culture. So I think we need to we all know how challenging it is at the moment. Talking to colleagues in the service, yourselves included, it's just really, really difficult. And some of the strong intent around transforming culture, it is been put on the back burner because of reacting to the pandemic and the next sort of current phase of challenges with the pandemic. Is that right? That's a question, because I think it's how do you, as as a leader and as a previous director, one of the challenges, how do you continue business as usual while responding to the fires that are setting up all around you? Because you can't afford to share your intent about transforming the culture and then become very responsive to what's happening in the pandemic. You need to try and do both alongside each other, which is a real paradigm and a real challenge. But it never has it been a better time for our profession, so all the people professionals, in terms of our rightful place at centre stage. That's where we should have been all along, but it's where we are now, because without the people professional, a lot of the response to where we are with COVID wouldn't have happened. So how do we embrace that opportunity to really drive transformational change that engages our workforce in a very different way? So we talked about, to me, justice, civility and respect, restorative is common sense, but isn't it interesting? If I talk about myself as a people professional, we are taught through our qualifications to follow process, policy, procedure. Now, I wrote a blog a few months ago about what would happen if we did rip up all the policies. What would happen? Question. So I think it's common sense, but common sense isn't very common. And for me, it's about looking at your processes, looking at how you approach things, and what we do very good in HR, particularly about meeting hurt with hurt. So something's happened, an incident's occurred, what do? We adopt draconian measures, going through a policy procedure that ultimately hurts everyone that's involved in that process. And restorative just culture, justness, talks about how you really focus on who's hurt as opposed to who's to blame. Whose head do we need on a parapet, on a stick? And sometimes, things do go wrong and people are harmed and hurt in our care. And we need to be open and honest about that. But how we approach it can be a very different lens with which we look through. So there's something for us as professionals, this is what my journey I've been on, is a mixture of emotions when I've looked at how you could approach things differently. So putting a mirror up to myself. So when I've gone through as a director, particularly around dismissal appeals, would I have done anything differently? Would the outcome have been different? Would I have approached it very differently? The answer to that is yes. So I felt a sense of guilt of and I've not dismissed a lot of people, but there are those that I think actually, if we'd have approached that with a restorative lens, the outcome would have been very, very different. So again, it's really, I suppose, throwing up your practice, everything you've been taught as a HR practitioner, and really looking at things differently. A number of organisations, including Merseycare and others, the ambulance service, have looked at removing the word grievance, and looking at restorative approaches to disciplinary and civility and respect, and using the work of Chris Turner that David mentioned earlier. So feeling uncomfortable in this transition to a transformational culture, one that is restorative rather than retributive, is uncomfortable, and that's good. You're all staff that work in the NHS in various roles that you work in, and you want to go to work to do, or not go to work perhaps necessarily at the moment, but work to to get the motivation, to get the hierarchy that Maslow talks about in his hierarchy of needs as the basics, but you want joy at work. And it's about creating that joy by creating a culture that embraces diversity at the broadest sense, everyone's experience that they bring. So I suppose it's, what would I finish with? I'm conscious of the time. So the paradigm is, how do you embed cultural transformation, moving to this transformational culture that is the right thing to do at a time when you're in, what's the word, in the pandemic, but in, you know, that's the focus. Staff are off poorly, the services are really stretched. We're running wards, functions at high risk in terms of staffing numbers. But how do you not throw the baby out with the bathwater? Your intent is transformation. You need to continue on that. And it's hard to do that, but it's important as leaders that your leaders in your organizations, you as practitioners, look at how do you keep it alive? How do you keep that focus on this is the right thing to do for service users, for patients and their families? Be curious. So David's outlined a lot of things there, and there's a lot of things in the chat around referencing. So again, be curious about it. The Sidney Dekker, he's one of the players in this arena. You know, read his books around transformational culture, just and learning. There's lots to be researched, but the important thing is that you read it, but you also then think about how do you put it into practice. And one small thing can make a huge difference. So yeah, I think it's interesting at the moment because it's a paradigm shift between responding to what we're required to do from a national legislative point of view to where we want to be from a cultural point of view. So it's trying to manage some of that paradigm is challenging. So I don't envy you all in the current service. I look at you with greatest of respect in terms of how you're managing the current climate. So yeah, big advocate for transforming the culture. It can't be done overnight. Think about how you eat an elephant one chunk at a time, not all of it at once. So here, hopefully you'll learn some aspects of it that you can do a bit more research on. So I think that's enough from me at the moment, but happy to answer any questions you may have of us, HPMA, what we're doing, or myself indeed. So back to you, David.
I think it's such an important message that you're sharing there, the importance of culture, but also just the challenge of doing this. And I think one of the challenges that we often face, Nikki, is people say, well, I've got business as usual. I don't get time to do culture. And one of the things that we say is actually culture should be business as usual. So it shouldn't be, oh, I'll do Tuesday, I'll do my clinical work, then I'll do my management work, then I'll do my culture work on a Thursday. It's like those all integrate. And I just wondered if you had any thoughts about how we can integrate culture, whilst you said is so much there and it's such a big topic, but if we see it as being a task that we need to get to tomorrow, like many tasks that we need to get to tomorrow, it just gets pushed back and pushed back and pushed back, and to an extent we never get there. How can we make it normalized that managing culture and culture transformation is part of business as usual and BA? I just wanted, it's a big question, but I just wanted to coming back on the point that you're raising, how could we do it?
Yeah, I think it's, I wouldn't want people to go away with the message that culture is something separate. It is very much integral to everything that we do. And it goes back to your points around, you know, what's the core values of the organization? How are people behaving? I say, are the values laminated or are they lived? It's very different if they're lived and in the DNA of the organization. That's about cultural transformation. So it's not just about writing a strategy, setting out your stall in terms of how you're going to approach things. It's how it's lived. How do people demonstrate from the top? And it does have to start with the board, in the broader sense of the board, the execs, the non-execs, and it's making decisions based on the culture of the organisation in terms of your intent, which is difficult. And I know Rita's put a question in the chat. It's difficult to manage that sometimes with what is being asked of you nationally, politically, and obviously we can talk about that till our heart's content in terms of current issues that are going on with the government in particular. So it's embedding it into everything that you do. So all your processes, I think you call it employee life cycle, and not still behaving in the intentional way you intend to behave as a leader in your organization, as a practitioner, rather than maybe succumbing to the pressure that you will feel, which is hard. It is hard because you feel that pressure as a leader to do the right thing, to lead from the front, when sometimes all you want to do is perhaps put two fingers up to the what's going on nationally. I say that in the nicest possible way, because you don't perhaps align with it from a personal point of view, but it's about sustaining and being you in a difficult circumstance, because we are seeing, interestingly, increases in employee relations activity because of people's behaviour, because everyone's just worn out. They're sick and tired of being pulled pillar and post. We're seeing a high attrition of people from the NHS who can retire early at 55. It's a minefield, but it's about staying true to self, staying on the road that you've intended and not halting things, and managing some of that, what I would call noise, proactively, but letting your people deliver things in the way you intend them to deliver in terms of their behaviour, the culture you are trying to create, and shout out. So if somebody's behaving inappropriately, it should be shouted out. It should feel safe to speak up, no matter what level you are in the organisation, and how that's encouraged through behavioural frameworks against the values, those types of things. So there's lots of things, but it's keeping that intent and sticking with it despite what might be going on around you. Easier said than done, I know. But it's what leaders need to be thinking, and how they develop strategies to do that for themselves.
I think Tracy's just echoed your Edith. I would say, if you're not doing that, you're not leading. I'm sorry to put it as bluntly as that, but if you're not doing that, you're not leading. And so if you're not doing that, then it's calls into question, what is it exactly that you're doing? Because you're not leading. Your crisis management, your firefighting, you're doing all the things that might make a trust function day to day, and it sort of ticks along, but you're not leading. And you've talked about leadership.
What's really
recording it.
Just very quickly, what's really interesting, I was an interim HR director at the start of COVID, which seems like a lifetime ago. And in phase one, I don't know if people would agree, it felt very light touch. So we've never experienced this before. Go away, think about how you create solutions to what your challenges are. And the freedom to respond, the freedom to be creative, to be innovative was there probably for about 2-3 months. And then came the direction and diktat, if you like, in terms of how you need to deal with certain things. That was when I think pressure was on leaders around their cultural intent, because they wanted to do A, but then had to respond to other pressures. So it's interesting when people are given freedom to respond, freedom to act, innovation, creativity is there in bucket loads. So, yeah.
Really interesting point. I think that's one of the signs, I think, of COVID, is we did trust people, we did give them the freedom, and they were able to, and they were active with loyalty, and they were able to come up with very creative solutions. And I think you're right, there are such enormous challenges on organizations in terms of how we do this, but the requirement is absolutely key. Something needs to happen, and I think in some respects focusing on culture is perhaps the one thing that we can begin to focus on and change and shift in order to drive those changes, because where else are we going to focus on? And it seems to me that culture, we're constantly going back to culture.
Well, it's that old adage, isn't it, Peter Drucker, culture eats strategy for breakfast. So all the strategic intent you've got, unless you've got your culture right and people behaving in the right way with the right intent, no strategy is worth the paper it's written.
Yeah. And dinner and tea. I think you're right to say it really is. Fantastic. Matt, Blair, I'm going to come over to yourself, and I just wanted to share a few thoughts on the resolution framework, because I think in some respects the resolution framework has piqued people's interest. So I just wanted to say a few words on this, Blair, and then we're going to come over and talk about the kind of the research project and the Trailblazers initiative, and how and what would happen if a trust wanted to become one of the Trailblazers and become part of this research program, what that might look like and how it would work. But Blair, if it's okay just for me to take a few moments, and I will apply brevity, and when I say that, it means I'll be waffling on for the next time. I promise I won't. I'm just going to share some thoughts on the resolution framework, just so people can see this, because to me, If we're serious about culture, really serious about culture, let's get a shredding machine today, turn it on, and shred those processes. If we're serious about this, if we're not serious about this, and we are pulled and drawn between people and process will win. And we can never truly call ourselves a compassionate, just, or restorative organisation whilst we retain those corrosive and damaging processes, grievance, discipline, and performance systems in particular. So if we are serious about driving the changes that we're talking about here, this afternoon, shred the procedure. Now that might sound, whoa, shredding the process. We've relied on this, but we've relied on it for delivering the wrong outcomes. Now, I'm not an anarchist. I believe in a rules-based system within our organisation. It's just that rules-based system is the wrong rules-based system, which has adverse outcomes for everyone who touches them. And if I was given advice to anyone in an NHS organisation or anywhere else, is whatever you do, never, ever, ever touch a grievance procedure, a disciplinary procedure, or a performance management system. It will burn you, it will hurt you, and it will damage you. It's a rules-based system, which is the time is up for this retributive model of resolving issues. The time is up for punitive and adversarial systems. That retributive process is clearly demonstrated through those traditional disciplinary grievance and procedures. The only benefit are the vested interests of those people who benefit from the process. The only people who benefit from the outcome are those people who benefit from the damage that is caused by them. And when you start to look at the costs, and particularly your legal fees as a trust, and the amount of money spent on investigative settlements and protecting yourselves against the employment tribunals, we can start to see there are people who benefit from an adversarial and punitive-based system. If all of that money that is used to manage or prevent an adverse outcome in a tribunal was invested in one single month period, you could drive a significant change across a massive, complex, acute trust, just based on what the costs of 1 month of legal fees in a trust. So there are winners, but it's not the patients, it's not the employees, it's not managers, and it's not the organisation as a whole. And they don't work and they don't resolve those issues effectively. So let's have some imagination. What could the world look like if we applied some imagination? And the imagination can only come once you've done the shredding. And by the way, there is some value in shredding those procedures. And I don't want to kind of alarm you, because if you've got a niece or a nephew who's got a hamster or a guinea pig, it makes wonderful bedding material for their hamsters and guinea pigs. So there is a value to it once they've been shredded, is you do have some bedding material for a soft, furry mammal if they have it. So let's imagine a world without this stuff. So what do we put in place? We've still got a rules-based system, but the rules-based system is a different rules-based system than the punitive sanction-based methodology that we've become so familiar with since the 1990s. So it's a new approach to the resolution framework. So the resolution framework that Donna was talking about and numerous other organisations now adopted, it offers a new approach for resolving issues. It's the most effective way to deliver transformative justice. You remember I talked about the marriage or the blend of restorative justice and procedural justice. It's values-based, outcomes-oriented, principle and person-centred. It promotes adult-to-adult conversation. It's bringing together key stakeholders to resolve issues constructively and effectively at the earliest possible stage. There's a triage system. So rather than just a 3-stage process, we ignore stage 1. Let's forget stage 1, informal resolution, because that never works. Let's just go straight to stage 2. So there's a 2-stage process, really the reality. But actually that doesn't work. So what we have is a triage mechanism using a resolution index with a set of clearly defined indices to then identify the most appropriate bucket to put the case in. I'll talk more about that in a moment. So there's a resolution index in the triaging process. Much greater emphasis on these early restorative processes, facilitated conversations, mediation, direct dialogue, coaching, mentoring. Now, remember in the people function there, the people function is no longer case managing ER processes. The ER function is now acting as a coaching and a mentoring and an enabling function to enable all of this to happen. They're working with union partners and managers and others to direct and steer the right resolution process at the right time. It underpins the development of a transformational culture and is fully legally compliant with the ACAS code all statutory regulation and regulatory requirements of the organisation. And it can cover the discipline procedure, the grievance procedure, or all three, which was the slide I just slipped over that. So this is what the resolution framework looks like within a trust. The orange bar at the very top reflects quite an important part, which is the management colleague to colleague conversations that are going on within our trust. Quality conversations driven by compassion, understanding, and a desire to drive insight and learning within an inclusive and a psychologically safe workspace. It's resourced, it's supported, it's valued, and our managers are trained on how to have the quality conversations that underpin the stage of the of local resolution. We don't have a disciplinary procedure, so there's no disciplinary warnings, there's no PIPs. I mean, performance improvement plans. Imagine a world with no PIPs. Imagine a world with no badly developed, badly organised, badly delivered disciplinary warnings in the line. So that's all scrapped, it's completely gone. So we have action plans that can be developed. We have warnings, and I must nod to well, I'll mention the reference, but the work of Dick Grote and discipline without punishment text, but we have warnings instead of reminders rather than warnings. So we're reminding people of the behaviours. We're using nudge and positive psychology, using core competencies to drive the right behaviour. Now, not everything can be resolved in that orange space. So we may need to escalate into the next phase. The escalation is through a process called a request for resolution. And the request for resolution comes into a resolution unit or a resolution centre. We now call them resolution centres. That language we're finding is really landing well in trust, the resolution centre. And the resolution centre will receive the request for resolution, and then we'll triage it against the resolution index, which has been predefined. And within LAS, before you joined, Donna, we spent an awful lot of time working with trade union partners and others, defining the resolution index, so that there was and it was tested against a number of scenarios. Based on the score, so there's an aggregate score from the resolution index, would identify does it go into early resolution or into formal resolution. And within early resolution, you've got a number of, I describe them as buckets, go back and have a conversation with each other, coaching and mentoring support, facilitated conversation or roundtable conversation within the trust. Mediation, many of you have a team of internal mediators or use external mediators. So mediation support provided, or potentially, as is often the case, a wider piece of restorative work within a team or in a group. Now, the overwhelming number of cases are resolved through that route. However, in more serious cases where we've got a high score on the resolution index, or indeed there's an allegation of gross misconduct, the formal route or formal resolution route would include, and we use the Dido-Hardig 7 principles and Bart's pre-disciplinary checklist have all been sort of considered as part of this as well. So an investigation to establish the facts, a good, fair, robust investigation. Sorry to say that's not always the case, but we really advocate good investigative practice in the way we investigate. Suspension, which we know is not a neutral act, and always two people would develop a suspension and a suspension plan. So again, following the Harding review. And then it would result in a formal resolution meeting. So no longer do we have disciplinary hearings, and the word hearing has gone. I mean, it just immediately brings up parent-child type stuff going on in the workplace. So a resolution meeting chaired by a senior manager who's highly skilled in running a resolution meeting, and the outcomes from the resolution meeting can be back into a resolution process, a third or final reminder, or indeed in gross misconduct dismissal with or without notice. So there's quite a range of remedies and outcomes through the formal resolution meeting, and the chair is supported by the resolution centre, trained, and there's governance frameworks within there as well to provide good practice. So continuous cycle of learning from cases, anonymised case reviews, and critically, the people who use resolution are thought of as customers. So we're seeking feedback, and I'd be interested to know if any trusts do at the moment ask for customer feedback for people who've been dismissed or through a grievance procedure. We actively seek feedback. How did it go? What feedback have you got? So we get that customer feedback. In order to be able to stay on the right side of every regulatory requirement, there's a right to appeal, as you would absolutely expect. And the appeals process is really important as well in terms of reviewing the case and assessing the rigour and the robustness of the case. And Blair, I'll hand over to you now just to in a moment, but this is what we start to see coming out through the resolution framework and some of the positive impact, and also reducing some of the negative impact of the other processes. So it has a very significant impact, and there's some things which are retained in our current systems. So dialogue is fully legally compliant. Managers are still expected to manage, are still robust. You still have the ability to take serious action, but there's so much that's new there in terms of the way that it works. But this restorative rather than retributive approach. And Donna, just to say, this London Ambulance, the case study, and I think Matt, I saw on the chat function, has shared the London Ambulance case study. So I just wanted to share that because I think it piqued quite a lot of people's interests when we raised that. There's so much more, because that's just one of the 8 enablers. So each of those 8 enablers can provide lots of content, but poor old Blair won't get a word in if I don't stop there and hand over Blair. But Blair, you've been leading on the Trailblazers initiative. We've got cohort 1 in, and that's going really, really well, which is a mixed cohort. I'll let you speak about it, but it's over to you, Blair. I'll stop sharing because I know you've got a few slides. And then we'll stop for questions, and then we'll get into a little bit of a group work and just get people thinking as well. So Blair, without further ado, over to you.
Yeah, thanks a million, David. I don't know, I know you had suggested maybe we would catch a break just before the workshops. Is it maybe worthwhile just giving everyone a couple of minutes now? Have we got a straw poll on that?
I agree, actually. I think that's good because it's quite a lot of time to be sat at the desk. So just even if it's just for spinal health.
Yeah. So we're on 2:48 just now. Shall we catch back up at 2:53 or something like that?
Yeah, 5 minutes. I think that's a really good idea. Good call. So it's a 5 minute, just a comfort break and a stretch of the spines, and we'll be back in 5 minutes. Great idea. Thanks, Blair.
Great. Thank you.
Or competing with the school run, Blair. On the I can see, but people are really enjoying the session, and I think someone's going out and hoping to be able to join us after the school run. But I think people are saying that they're going to look forward to hearing it. But I think we've got 1 or 2 folk, but we've still got good numbers. So we'll get started in a minute. But I'll just let you know if you've not seen that already. If, a few people having to go.
Yeah, I was competing with a brief dog walk there. They had to get out, so that's why I said, give me a 2-minute break.
Is that right?
Before they kicked the door down.
You were competing with me rabbiting on about the resolution framework as well, but it's like kind of it. I think people would keep interest. Well, I think we're almost ready to go again. Seeing your message about knowledge, I did spot that. A really interesting point, Lisa, with the current retention and recruitment crisis. I wonder if we saw all staff as customers, how we might change thinking and cultures. Absolutely love that. And there's yeah, I think it's a really important point, not just on the resolution framework, but so much more. And actually, if I was a CEO of a trust, which I'm obviously not, I would have the people function and patient experience function sat in the same office, and that interconnection between patient experience and employee experience is so clear, but oftentimes they're at completely opposite ends of the organisation, and sometimes, not always, but sometimes do not connect. And so building that connection, I think, would be key. But Blair, over to you.
Sure, yeah, it's an interesting paradigm shift that you're describing there. Just that a shift of mindset, isn't it, from just staff to looking at these people in the organisation as our internal customers. It's really interesting. And I think just before I share my slides, I think Nikki made a really interesting point there, which I thought was so valuable. It's so easy when we're embarking on a change programme to start. To throw out everything that's gone in the past and to rubbish everything that we're doing in order to pave the way for the new future agenda. And I think it's really important that we use that appreciative inquiry, focus on what's being done well in the organisation, and carry it forward as almost building on the strengths that we've got in the organisation already. So I thought that was a really interesting point from Nikki as well. Let me just share my screen here. You got that okay, David? Yeah. Great, thanks for that. So as I mentioned earlier in the intro, culture really has kind of been front and centre in all of my work, and I think it's fascinating to me basically because it's patterns of behaviour but at scale, and these are so powerful in an organisation, and we see that organisations with a positive winning culture are almost 4 times as likely to be top performing. So the business case really is clear for a transformational culture. We know that it enhances strategic execution because everyone's on the same page for a start, and everyone knows what's most important for the organisation and for the people in it. So I think culture can't be overstated. The importance of culture can't be overstated. So I just want to take really 10 minutes of your time to give you a brief insight into the steps that we take to integrate a transformational culture in organisations. And I know David's described the framework and the elements of the model, but really I just wanted to focus down a little bit more on how that actually looks in organisations and how it works in our Trailblazers model. So an integral part of the transformational culture work that we do is the Transformational Trailblazers programme. It's a network of like-minded organisations across all sectors, sizes and levels of maturity. And the common thread really amongst all of these organisations is that they're really passionate about putting their purpose, their people and their values at the heart of their work, and are really committed to developing a transformational culture. Now at the moment, these organisations vary from universities to small hospitality companies to iron foundries, and kind of all flavours in between. And the idea of the Trailblazers is they work collaboratively in cohorts to engage in really high quality research and analysis, which helps us to baseline and critically how we measure success. And this community that we build support each other as they move through the journey of integrating a transformational culture, critically how they deal with the challenges together, share best practice and engage in action learning together. And overall, the Trailblazers, like I said, have a vision of becoming fair, just, inclusive and high-performing organisations. I think the Trailblazers really lead the way in revolutionising their organisational culture, and we know that health and social care organisations are presented with a unique and nuanced set of challenges. And obviously it goes without saying amongst everyone in this call that the pandemic has had an unprecedented implication on the sector and specifically on the cultures within these organisations. So with that in mind, we're bringing together our next cohort specifically in health to help research these challenges and share organisations' approaches to combat the challenges that they've faced as a result of COVID, and probably challenges that were in existence before COVID came around. And obviously, I don't need to tell you the immeasurable pressure that's been felt across the sector, but also the huge hurdles that people and the systems have overcome. And to come back to Nikki's point a little bit, they're really focusing on the good work that's been done during this time, capturing it and moving it forward as well. So we really want to help to understand the consequences of the impact of culture and the potential impact and the benefits of a transformational culture and how it can move us into the future. And I think we all know that adapting culture really isn't for the faint of heart. It's hard work. It requires sustained effort by leaders and a real willingness to examine all parts of the organisation. But we all, I think, well, I know, and I think we'll all know on this call that culture change really is worth it. It can be the catalyst that can help organisations to thrive in the long term, provide better care, become better employers, and really achieve the organisation's strategic objectives. And I think the benefits are clear. I just read a report this morning from the King's Fund that shows that only a fractional increase, 0.02% or something like that, increase in the staff engagement scores correlate to millions of pounds worth of saving for the average trust. So there's a direct result of developing a better culture within organisations, and it can really be seen on the bottom line. So the business case is absolutely critically clear. Now, I know that we're all here because we know the power of culture, and I know that some of what David said probably aligns with your values and your ambitions for your organisation. But I also appreciate that the decision to adopt a transformational culture really can't be taken lightly. We need evidence to support the decision, and we need a robust analysis that really answers the question, is this right for us right now? And I know that culture change, like I said, is hard, but it also is a hard sell for your internal stakeholders and your decision makers. And it's for that reason that we've developed a tool called the 5D Review, which stands for Discover, Diagnose, Design and Deploy. That tool really is a first step towards enabling us to understand the priorities and the opportunities for action in the organisation. It really importantly allows leaders to begin to take robust, evidence-based decisions to improve the performance of the organisation. The process involves analysing the data that already exists in the organisation and critically engaging with key stakeholders to build an awareness of what the culture is in the organisation and articulating the current culture, clarify the critical organisational priorities, and ultimately facilitate thoughtful action. The 5D Review really acts as a litmus test to provide a launch pad for the implementation with a scope and a pathway towards integrating a transformational culture. In terms of methodology, we embrace both the diagnostic and the dialogic approaches to OD and design, which provides us with a snapshot of the whole organisation system. So the dialogic elements, I mean, and really the underpinning theory behind transformational culture is dialogue is key. So we really leverage the data that already exists to compare the current culture to the desired future state, and bring people together through conversations, interviews and focus groups to understand and uncover the issues that really matter to them. And this allows us really to provide cold, hard data alongside powerful stories and narratives from people affected by the culture. And I think we all know how compelling the combination of data and stories is to effect and change, and also to allowing us to understand the situation and the context. So the three main objectives of the review then are to start open and honest conversations with our people about the way that things are, but critically the way that things could be if we did this better, and to act as a catalyst for thoughtful and informed actions, and then also to provide an evidence-based scope and plan for next steps. Now, I'll ask you to indulge me for a few minutes here. as I mentioned at the beginning, I worked for Virgin Atlantic, so I spent much of my life working in aviation, and I love a flight analogy. So it gets rid of this feeling that I'd love to get in a plane at the moment, which so many of us have been wanting to do for so long. So I suppose to me, embarking on a culture change journey is very similar to preparing for a flight. Firstly, we need a really skilled and capable crew. The leader needs to be well versed in the journey and its objectives, and they need to ensure that everyone is on board with the vision of the change journey. The case for change needs to be really understood by everyone involved, and critically, the leaders need to possess the technical and non-technical skills to carry out the process safely and effectively. We need to gather all the information about the journey first to make sure that we're prepared and we understand the environment and the route, and we need the right resources in place, and this is what we call our discover phase of our 5D review. We need to really be aware of the conditions at the starting point, at our end point, and at every point along the journey, and understand our performance under those conditions. So really asking the question of ourselves, is the current culture in our organisations helping us to achieve our strategic objectives, and is it helping us to deliver better care? And we call that our diagnose phase. And then critically, the captain, the crew, the passengers, and all the bags need to know and understand where they're going, and need to be going to the same place. And this, the end point that we're trying to design needs to be well articulated, clear, and understood by all. And this is our dream or our desired end point. And I suppose then we need to chart our path. We need to have a clear map to get to where we want to get to, and a clear strategy about how we're going to get there. To help this, we build a collective leadership strategy which signposts the way, and this is called our design phase. And then for deploy, we need to make necessary course adjustments as we travel along the journey. And we need to understand, as I said, the environments along the journey, and make sure that we're responding well to them. And if it's necessary for us to change our direction and change our destination, we're all aware and we all get there together. So just a bit more about our diagnose phase, which analyses the data from our desktop review and the stakeholder engagement. And this is just a link back to the 8 enablers that David was describing earlier on. So we use the 8 enablers of the transformational culture to assess the status quo. And as David described, we know that the 8 enablers work as a system which delivers powerful organisational change and enhanced performance. So it's useful to benchmark the organisation against this paradigm. So each of the enablers have indicators, which we call markers, that we look for under each of the enablers. So for example, you'll see here the values first enabler. We know that the values are the golden thread that runs through the organisation. So one marker that we look for in terms of values is the values and purpose clearly defined and widely owned in the organisation? And then another marker that we might look for is the purpose and the values central to and evident in the organisation's strategic vision? So from these markers, we score each of the enablers on this circumplex that I've shown here, and that really shows at a glance where the organisation is strong and where the areas in which we need to navigate. And again, like I mentioned there, we really focus on appreciative inquiry at this stage of the process. To understand what's going well, we need to know what our key strengths are, and how we can help these strengths to navigate through the areas for improvement. We also analyse readiness for change. So we use 3 catalysts here: attitudes toward change, resources that allow change to happen, and conditions for change. And this gives us a really robust insight into how fit the organisation is to make this change. And from this diagnosis, a clear and cohesive picture of the current states emerge, and a clear appreciation of where the work lies. So in the design and deploy phase here, the last stage of the process, we utilise the findings from the discover and the diagnose phase to inform a scope and a pathway towards integrating a transformational culture and a clear strategy for deployment. We use all of the knowledge that we've built up during our diagnosis of the current state, and then compare this with our desired or dream state. And then we're going to work with you to co-create interventions which move the organisation from the current state towards the desired future state, and all of the deliverables that are going to be delivered along the way. And our key objective here, more than anything else, is to develop capability within the organisation that's going to ensure the long-lasting effectiveness of this change programme. And I think enhancing skills and capabilities ensures that the project is going to sustain and is going to maximise your value, enabling you to work in emergent interventions as they arise. And for this, we use the 7 C's, like David described earlier on. These are the outputs that sustain the transformational culture along the journey. And for us, we're going to really work with the organisation to understand how we measure the success of the journey all the way along the process. So, for example, how can we measure collaboration in the organisation? It's very nuanced, it's very specific to your organisation, but at least it allows us to benchmark and track our progress along the change journey. And all of this learning moves into the Trailblazers cohort. All of the learning is shared, stories of success are promoted, and useful resources are really shared amongst the group, so that there's a collective knowledge being built up across all of the organisations, so that sometimes someone can come with a question to say, how did you actually deliver that in Anger, in your hospital or in your organisation? And people are really able to assist each other through the change process. So that's a really brief overview of the process for me. I'm conscious that I don't want to drill you down into too much detail here, but really interested to take any questions that you have. And if you've got anything, my email address is there, my LinkedIn's there as well. Please feel free to touch base, and I'll pass you over to David now. And I think we've got some more conversation to be had and to hear from you guys as well.
Thank you so much. Really powerful presentation, a really powerful metaphor as well in terms of that journey. I really like that, bringing in that experience from aviation, but it really set out clearly each of those different stages of the 5D review and their impact in terms of shaping the journey, giving clarity on the destination and helping us to achieve those objectives. So thank you, Blair. I'm pretty confident there'll be questions for you, so let's just take a stop check and see if anyone's got any questions. So give a couple of minutes if you've got any questions for Blair, we can respond to those. And then the final part of the session today, we're just going to go into some breakout rooms just to sort of mix things up a little bit, give you a chance in smaller groups to think and reflect on the conversations that we've had so far, and also to think about your sort of involvement in the Trailblazers initiative. As I mentioned at the beginning, the research process includes sort of broader sampling through surveys of focus groups and interviews. But the Transformational Trailblazers initiative, we're looking for a cohort of around half a dozen organisations who want to come in and be part of that Trailblazers initiative. So giving you a little bit of a chance to think about that. So just while I'm setting up the breakout rooms, please feel free to ask Blair any questions, and particularly if you've got any difficult questions. I think Blair particularly likes the ones that you've been perhaps sat on that are really difficult. So feel free to ask those questions if you wish, Blair, just to set it up for you while I deal with the breakout session.
Yeah, go for it.
Fantastic. Let me see. It's a long time since I've done Zoom breakout sessions, so let me just remind myself how I do this. Assign it automatically. So we've got 50 people on the session. So if I allocate 12 breakout rooms, and I put 10 breakout rooms, that's 5 per participants per group. So if there are no difficult questions or other questions for Blair, sorry, Blair, I shouldn't have said that, but if there are any questions for Blair, please do feel free to share them. But in the absence of that, what I'm going to do now is just share my screen again. These are the questions for the breakout session. So what steps, based on what you've heard today, and I think it's, as Blair said, and as Nikki said as well, there will be great stuff going on in your trust as well. So what are you already doing, and what steps do you think need to be taken further based on the conversation that we've had today to help you to integrate and embed a transformational culture? And are you ready to become a transformational trailblazer? Is it something that you would be interested in participating in? So those are the sessions. I would suggest that we have around about just over 10 minutes, so probably about 12 minutes. So we'll set those up now. I'll also share the question with you in the breakout rooms, which I can do. So I'm going to do that right now. So what steps can you take, or are you taking, and are you interested in being a trailblazer? You will automatically be allocated to a room, and I'm going to set these up now. Welcome back if you're just joining us. So we've given people 60 seconds. So with that, and Lisa, welcome back. How are you finding the workshop today, just while we've got a few minutes? Lisa and Yvette, any thoughts, any questions?
Really interesting. Sorry, I missed the beginning of it, David, but what I have heard is really good. You know, we are interested in the transformational trailblazer, so I'd like to learn more about it.
Oh, fabulous. Absolutely fantastic. Well, we look forward to sharing more with you, Yvette. And which trust are you from, Yvette?
South East Coast Ambulance Service.
Yeah, and we're just starting working with you. I don't know if you're aware.
Yeah. You're doing the mediation work with us.
Right. I was hoping you might become a trailblazer with that. I had my fingers crossed that you might, actually. Oh, I can see. Yeah, that's good. That's good. Yeah, that's really exciting. Oh, yes, we'll pick that up. Welcome back, everyone. If you're just joining us, and sorry, Lisa asked you the same question, but you didn't get a chance to. Any thoughts or feedback, Lisa?
Yeah, I'm working at ICS level, so I guess I'm just trying to think about how I might kind of think it at system level rather than at organisational level. But it's been useful. Thank you.
Hi.
Well, we see this absolutely linking in with the new ICBs. I think they've been pushed back to July now, haven't they? But if you look at everything that we're discussing as an infrastructure for the ICB and your place-based work and PCN, particularly in the PCNs where everything seems to get either works really well or gets bogged down, we've designed it to fit into the ICB structure. So it's something that we'd be really keen to talk about, because I see that as being such a powerful way of delivering health and social care. But if we don't get this culture stuff right, it's going to really be difficult. So that's something that we've specifically had an eye on, the integrated care systems and so on and so forth as part of this work. So thank you, Lisa. Maybe it's a conversation to have. So welcome back, everyone. I think, is everyone back in to the session? Hopefully everyone is back into the session. I hope that you found the breakout sessions useful. I can't see everyone, but hopefully everyone is back in now. So a very warm welcome back. So we're into the final 5 minutes of the session. So it's an opportunity based on the breakout rooms that you've just had to share any thoughts, insights or questions. And also, as we've just been having a conversation there with Yvette, if anyone is interested, we're not asking for you to commit and sign up to become a trailblazer now. That would clearly not be a sensible question. But are you interested in becoming a trailblazer? Whatever role that you play, there's an opportunity to contribute to the research that we're doing with the HPMA and the Institute of Organisational Dynamics anyway, by virtue of being part of the surveys, the focus groups and the conversation that we'll be having. So you will be able to contribute, but it's the trailblazers that we're really wanting to focus on, because that will then give us the case study evidence, which then can drive that proof of concept to organisations, and will be, as the name suggests, a trailblazer. So really over to yourselves. Any thoughts, feedback or questions that have arisen from the breakout sessions that you'd like to share? And again, with the group has reduced in size now, often happens, so feel free to come off mute if you wish to ask a question with your microphone, or if you wish, please do use the chat function if you wish to.
I have a question.
Yes, please fire away.
Hi, I guess one of the things that we said was almost trying to trial some of this in sort of smaller departments within the organisation before spreading out to everyone. Do you find that that's an approach that tends to work well, or does it actually work better if it's something you try to implement from the very beginning to the whole organisation?
Yeah, I mean, I think it's an interesting question. And I mean, some organisations lend themselves to pilots more easily because they might have a sort of geographical separation where they might have 4 or 5 different sites and might want to run a pilot over a site. I think where it's a single acute trust, or if it's on a single site, it becomes harder to do it because of the interaction and the interrelationship between all of the various departments. So it's very situationally specific, Barty, but running pilots and testing it is a really sensible thing to do if it can be done and it's not overly onerous for everyone concerned. So it's certainly something that is worth considering for sure.
Thank you.
You're welcome. Any other questions, thoughts or feedback before we start to wrap up? So I'll just go back into, so Frederica, you're talking, so we'll talk about the integrated care systems, the place-based work, PCNs, and looking at the work there at Birmingham and Solihull. Yeah, again, it's a really interesting area, and we're hoping to pilot some work, particularly around transformational culture in that structure. So please do come back to me with any questions if you wish. Ruth, you're asking, how do we express an interest in being part of the Trailblazer? I think we'll take that as an expression of interest, perhaps. But if you are in, I don't think we have a formal route of expressing interest. We maybe should do that. So what we'll do, we hadn't thought that far ahead, actually, Ruth. But what we'll do after this workshop with colleagues at the HPMA is write out to everyone and just ask you if you are interested to let us know, and then we'll have conversations with you and just sort of build that up. I'll just run through really quickly with you the methodology that we use for deploying the Trailblazer. So not to spend ages talking about projects. So this is our OD and project management methodology. So we start off by building the chemistry, and it's a chance for you to get to know us and you. And it's also a chance for you to get off the train as well if it's not the right direction of travel for you. So do work on chemistry. Then the 5D review, which obviously Blair has gone through in detail. Then any more detailed audits that might be required, particularly when it comes to HR processes. But we have various audit tools that we might deploy. And then we're into the sort of delivery modality using our consultants and project management disciplines. Then there's the evaluation and the long-term evaluation against the baseline indicators from the 5D review. And a real emphasis on learning and sustaining. So as part of this focus on transformation is building that corporate memory within that transformational culture hub, continuous cycle of learning and continuous improvement, and then sustaining the outcomes that have been achieved, as various people have talked about in the book. So we'll write to you after the session. We'll share the link. We've created a website to accompany today's session as well. So we'll put the recording up there. We'll put the Blair slides and my slides up there. We'll put any resources. If you've got any resources that you think would be useful to share, please let us know. Obviously, we'll be keen to share those, and we'll certainly be looking and working closely with NHS-CNI around the culture leadership program. I think it's a fantastic methodology, and we're learning quickly in relation to that and how the two might align or where they might align. These are my two books, Managing Conflict and Transformational Culture. As I said, the big inspiration in terms of changing some of those systems in the new world of resolution came from the work of Dick Grote and Discipline Without Punishment. And I'm a one-person PR machine, and I hope his book sales have increased tenfold, because it's a fabulous book and something I would recommend to anyone who's looking at driving a high-performance culture without the retributive and adversarial systems that we obviously are familiar with. So our conclusion is being able to, I know it's tough, it is tough, self-evidently it's tough, it must be horrendously tough at times, and I can't even begin to imagine how tough it is. So the last thing you need is someone on a webinar ending being super positive and optimistic. That wouldn't land particularly well, but there are reasons to be optimistic and there are reasons to be hopeful, and culture perhaps is the thing that we can harness that and accelerate that and energize us. And being innovative in that space. There's never been a better time to do this and to think about the needs of our people and the shape of our culture. We can't just move one bit and hope it's going to fix everything. And one new word or one new course or one new isn't going to work. It has to work across the system. So systems thinking has to be a key part of developing the culture. Drawing the values act as a golden thread within the organisation is so critical. And we talk about values-based systems, but I often see everyone talking about values, but the reality is those values don't have any meaning, and it creates dissonance. And actually, when we talk about values but we don't deliver them, it seeds mistrust, and it's the mistrust that creates the toxic cultures that we often see playing. So if we're going to talk about values, let's make sure they're a key part of that employee life cycle and employee experience. Time is up for retributive justice. We don't have to do retribution. We don't have to destroy people and their relationships to get a good outcome. We do not have to destroy relationships to prevent the risk of an adverse tribunal outcome. The Birchall test, which I call on the government to repeal with immediate effect because it's the most destructive test, does not demand that we deploy retribution in our organisations. We can do both. Managers and leaders are very clearly key. We've established that today. So let's support them. It's tough at the top. It's tough being a manager. It's tough. It is difficult. I don't like to get into finger pointing about who's at blame, but we know we need to support them because change has to come from our leaders and managers. And join the resolution revolution. You know, you might not have completely bought into my idea of wheeling the shredding machine out and shredding some of your HR processes, but I thought I'd share that, but I genuinely say this, is you'll never ever look back and you think, why did we do it that way for so long to so many people? So you've heard lots of speakers. A massive thank you to Nikki and to Joe from HPMA. What a wonderful, wonderful organisation. And I can't speak highly enough of HPMA and the fantastic work that they do, the support that they provide. They're a wonderful partner for us to work with. We're a very proud member of HPMA, and have enjoyed working as a partner over the years. And we've talked at events, and Nikki and Dean have supported our work. It's a real sense of partnership. So Nikki and Joe, a huge thank you for everything that you've done in terms of this session and getting us here. And obviously we're looking forward to working with you on the research collaboration. So again, thank you to both of you. Blair, thank you, as always. Fantastic presentation. Looking forward to working with you. And to everyone who's made it through to the last couple of minutes of the session, thank you to all of you as well. We'll contact you to talk about the Trailblazers. We'll launch the research now. This is the launch pad for the research. We'll be in touch. But for now, I wish you all the very, very best during these really uncertain and tough times. But like I said, let's make culture the thing that really brings us all together and drives those positive changes that we all want to see. So thank you all very much. Please do leave your comments and feedbacks, thoughts, reflections in it. It's great seeing you all coming in. So Ruth, thank you. Tracy, thank you. Donna, thank you as always. It's a pleasure, Donna. Megan, really appreciate that, as Michelle and Susan. Really lovely feedback. Oh, Nikki had to go, so she didn't hear me say thank you, but nonetheless, it was heartfelt. Thanks everyone. Abby, thank you. Ruth, yes, I think I'm doing so. Rhiannon contacted me actually to come and do a talk over in Wales, so I'll be in touch about that. You might hear me talking at an event coming up soon. So that's it. I think we'll call it a day. Thank you all very much. Please do leave comments, thoughts, feedback in the chat function. But for now, have a lovely evening, and we'll speak again soon.
Thank you.
Thank you all very much. Goodbye.
Thank you all. Bye.
Yeah, bye.
Thank you.
Bye.
Bye everyone.
Bye.